Hello guys. So today we shall be discussing one more important topic in the upper limb, that is your axilla. And as most of you know that axilla is a very important topic and many questions have been framed from this axilla. Okay. So we shall discuss about axilla now. So before discussing, I just wanted to give you a rough picture of axilla, guys. Whatever is present between the upper arm, this is your upper arm here. Okay. Whatever is present between your upper arm and the chest, this is your chest and this is your upper arm. So whatever space you can see here, this is called as the axillary region. This is called as the axilla, right? So if you look at the axilla here, this is the apex of the axilla, right? As you go down all the way, from the apex till the base, it is increasing. So it is like a pyramid here. This is the apex, this is the base. So it is increasing like a pyramid. So axilla is a pyramidal shape, which is present between pyramidal shape region, which is present between your chest wall as well as upper arm. Okay. So the first important point I would write is that this axilla is a pyramidal shaped structure or pyramidal shaped region. And where is this pyramidal shaped region? This is present between the upper arm as well as your chest. Okay, it is present between your upper arm as well as your chest wall, right? So if you look here, pyramidal shape in the sense somewhat it looks like this. Okay, so it is like a pyramid in this way. Okay, it is like a pyramid in this way. So this is how the axilla looks, right? So this part is called as the apex, yeah, and this part is called as the base. One is called as the apex, one is called as the base. Apex is always short, right? If you compare with the base is broader. And what are the walls here? These are 4 walls which are located here. Okay, now what are these 4 walls? I shall be discussing. So previously there was a question that is asked, what are the boundaries of the apex? So as you can see, this is the apex here. So they asked, what are the boundaries of apex? Now what will be the boundaries of apex, guys? Yeah, what are the boundaries of apex? Now if you look in the axilla, anteriorly what bone I have, posteriorly, medially what bone I have, that is very important. Okay, anteriorly if you see, here I have got clavicle. This is my clavicle. Posteriorly on the back, I have got scapula. And laterally, I have got humerus. Right? So what are the 3 bones once again? If you look at the apex is consisting of some boundaries, guys. Anteriorly if you see, there is, what is there? There is clavicle. Exactly back, what is there? There is scapula. Posteriorly we have got scapula. Anteriorly we have got clavicle. Right? And next, here if you see, medially, I have got my chest wall. Chest wall in the sense the ribs. Right? So anteriorly I have got clavicle. Medially I have got my chest wall or the ribs. Posteriorly I have got scapula. Okay, so the same picture, all these 3 structures together they form the apex. Okay, now let me draw these structures. Anteriorly what do I have? Yes, anteriorly like this I have got my clavicle. I've got my clavicle anteriorly. Then if anteriorly I have got a clavicle, then posteriorly what will I have? I will have a scapula. Right? So let us say that this is the scapula that is located posteriorly like this. Okay, let us say this is the scapula that is located posteriorly. And all of you know, guys, that posteriorly on the scapula, if you see this region, this is called as a dorsal side of the scapula. This is your dorsal side of your scapula. And on the dorsal side of the scapula, you can see a small notch here. Right? This is called as supraspinatus notch. Why supraspinatus? Because this is the spine. Above the spine I have got this notch. So I call it as supraspinatus notch. Okay. The same picture I have drawn here. See guys, this is your supraspinatus notch. Then this entire region will become what? This entire region will become the dorsal side or the superior side of the scapula, or the dorsal angle of the scapula, or the superior border of the scapula. Right? So posteriorly I have got scapula. Anteriorly I have got clavicle, and medially what do I have? I have got ribs, right? So let me draw the first rib here, okay? Let us say medially I have got ribs like this. So medially I have got, this is my first rib, okay? So again let me write down these things here. So this is So this is the first rib over here, right? And this is the scapula posteriorly, and this is the clavicle anteriorly. So this is the posterior, this is the anterior, as well as this is the medial border. So this forms the apex, this forms the apical portion, this forms this apex. Okay, I mean in the picture I have drawn that apex is having 4 borders, but actually there is no 4 borders. Okay, there is actually 3 borders here forming the apex. Okay, forming the apex. So exactly speaking, if I write it down, the anterior, posterior, as well as medial. This question was asked multiple times, guys. Multiple times they have asked this question. Now, anteriorly, what do I have? Anteriorly, I have got my clavicle. Okay. Posteriorly, what do I have? Posteriorly, I have got the upper border of scapula. Upper border of scapula. And medially, what do I have? Medially, I have my rib. Right? The first rib. So, what it's trying to tell you is that if you are putting a camera on the top here, right? So this is my axilla. If you are putting a camera on the top, if you look from the top, in the front you will find clavicle, on the back you will find the scapula, right? And medially here you will find the first rib. This is how you have to imagine the picture. Okay. After the apex, the next important thing we have got the base. After the base, next, there is nothing much to discuss about the base, but the most important thing to discuss is about the walls. So this central region, whatever is there, these are your walls of axilla. Okay, these are your walls of axilla. Now, whenever you discuss about these walls of axilla, first of all, let me write down the heading. Okay, these are called as your walls of axilla. Now, in these walls of axilla, same things. What are the things you have got? This is the apex, right? This region is your apex. If you come little bit down here, right? These are the walls. This is one wall. This is one wall. This is another wall. And on the back, you have got another wall. So there are completely 4 walls, guys. Okay. What are the 4 walls? This is called anterior wall. Exactly back, you have got posterior wall. This is called as medial wall. And this is called as a lateral wall. Okay. Anterior. Back you have posterior, this is medial, this is lateral. So in the anterior wall, what do I have? What is the muscle in the anterior wall here? This is called as pectoralis major, right? The anterior wall is having pectoralis major. So let me draw that pectoralis major. See, anteriorly I have got this large muscle, this is called pectoralis major. If I remove this muscle, okay, if I remove this pectoralis major, inside I will find a small muscle that is called pectoralis minor. So behind this pectoralis major, I have got another muscle that is called as pectoralis minor. This is pectoralis major, the next one is pectoralis minor. So anterior border is finished, right? Now let us discuss about the lateral border here. Okay, anteriorly pectoralis major and minor. Let us discuss about the lateral. Laterally, what do I have? I have got my humerus bone. Right? So let us say, let me first write this thing. This is anterior. Okay. This is posterior. This is medial. And this is lateral. So laterally what should I have? I should have this humerus. So let us say that this bone here is the humerus bone. This is the cut section of the humerus bone. Cut section of the humerus bone. And what is this dip in between? What is this depression in the humerus bone? That is called as intertubercular sulcus or bicipital groove. All of you know from my previous lectures. If you haven't watched my lecture on humerus, please watch that and then come back to this, guys, because there I have already talked about this important thing. I told you that we have got a line like this, we have got another line like this. Okay. Now this line over here, this is called as a lateral lip. And this is called as the medial lip. One is called as a lateral lip and this is called as a medial lip. In between the lateral and medial lip, I have got this yellow color shaded area. This is called as bicipital groove. So actually bicipital groove is like this. right? This is the groove. It has got a lateral lip, it has got a medial lip. I told you this long ago itself, but whoever is listening this lecture for the first time, so it would be clear for you. So this is your bicipital groove. Bicipital groove. Okay, bicipital groove. Clear? I have already told you to remember a mnemonic by a lady between two majors. I told you to remember a mnemonic, that is a lady between two majors. What does lady stand for? Lady stands for latissimus dorsi. Lady stands for latissimus dorsi. And where is this latissimus dorsi? In between the two majors. What are the two major muscles which we have? We have got pectoralis major. We have got teres major. Pectoralis major as well as teres major. Right? So on one lip there is pectoralis major, on the other lip there is teres major. In the center there is a lady, that is latissimus dorsi. In the bicipital groove, in the intertubercular sulcus, there is latissimus dorsi. Okay, I have also told you there that remember the mnemonic MET. What does ME stands for? ME stands for medial lip. Medial lip is having T. T means teres major. So teres major is present on the medial lip, whereas pectoralis major is present on the lateral lip. Okay, teres major is present on the medial lip. Pectoralis major is present on the lateral lip. This is a very, very important thing you need to know. Why am I telling you this point here? The reason is that here we have got two more muscles which I have to draw here, guys. What are those two more muscles? See, from the lateral lip, there is a muscle that is coming like this from the lateral lip. From the medial lip, we have got a muscle that is coming all the way like this. Now, what is the muscle that is coming from the medial lip, guys? That is teres major. So, this muscle which I have drawn here is teres major. And from the center, I have got, from the bicipital groove or the intertubercular sulcus, I have got another muscle that is coming all the way like this and covering the teres major. Now, what is this muscle called as? This is called as latissimus dorsi. So, we are done with the anterior, we are done with the lateral. Now, let us go on to the posterior. Posterior, what do I have got? I have got scapula, right? So, posteriorly, I have got my scapula all the way like this. So, this is my scapula. What is this? This is my scapula and this is my humerus. Okay, and this is my pectoralis major. This becomes pectoralis minor. Pectoralis major, pectoralis minor. Okay, and another important thing is that this is your latissimus dorsi. This is teres major. This is teres major, TMJ, teres major. Okay, not temporomandibular joint. This teres major. And so if this is a scapula, this is the dorsal side of the scapula, this is the ventral side of the scapula. In the ventral side of the scapula, this is called as subscapular fossa. On this subscapular fossa, we have got a muscle that is attached. This is called as subscapularis, which is also called as a forgotten muscle, right? So this is the dorsal side of the scapula, this is the ventral side of the scapula. So on the ventral side of the scapula, we have got a muscle called as subscapularis, I told you, right? So let us say on the ventral side of the scapula, I have got this muscle and this is called as my subscapularis muscle. This is called as subscapularis muscle. Okay, so we are done with the posterior side also. And what about the medial side? Medial side, here I have got ribs, right? So medial side, I have got ribs like this. So I will draw a rib here. This is a rib on the medial side. This is a rib on the medial side. And what is the muscle that is attached to the ribs, guys? I've talked about this in the pectoral region itself. What is the muscle that is attached here? This is called as serratus anterior. If you remember, I have already talked a muscle that is present here, and this muscle has serrated margins, right? So this muscle is called as serratus anterior, which is responsible for winging of scapula. Serratus anterior. Okay, now I have already talked that serratus anterior is supplied by long thoracic nerve, or you also call it as nerve of Bell. If long thoracic nerve is paralyzed, if long thoracic nerve is damaged, that would lead to paralysis of serratus anterior, and that is called as winging of scapula. That is called as winging of scapula. Okay, and again I'm reminding this thing that whenever you study winging of scapula, you should also study about partial winging of scapula. Winging of scapula is done by long thoracic nerve, but partial winging of scapula is done by spinal accessory nerve. Okay, long thoracic nerve supplies your serratus anterior, but that spinal accessory, which is responsible for partial winging of scapula, it supplies your trapezius muscle, which would lead to partial winging of scapula. Keep that thing clear in your mind. Okay, so these are the borders which we have to discuss, guys. Okay, these are the so-called borders. So first of all, let us write down all these things here. Let us write down anterior wall. We have got anterior wall. Okay, we have got let us say posterior wall. We have got lateral wall, and we have also got medial wall. Okay, now what are the structures that are present in the anterior wall? I told you anterior wall. Yes, what are the two things here? Pectoralis major as well as pectoralis minor, right? So can I write it down? The anterior wall of axilla is formed by two muscles. One is pectoralis major, another one is pectoralis minor. Two muscles, pectoralis major and pectoralis minor. When you look on the posterior group, posterior wall has got some muscles. What are the muscles that are located on the posterior side? Look here very carefully, guys. I'm going to divide this picture now. Look here. If I draw a line like this, right? If I draw a line in this way, right? Now you tell me where is anterior, where is posterior. So this is anterior, this is completely posterior. So in the posterior side, what do I have? I have got scapula, I have got subscapularis muscle, I have also got latissimus dorsi, I have also got TMJ, that is teres major. So what are the structures that are located on the posterior wall? I have got latissimus dorsi, I have got teres major, and I have also got subscapularis. So these are the three groups of muscles that are located on the posterior wall. When it comes to the lateral wall, now tell me what are the structures that are located on the lateral wall, guys, right? Let us look at the picture. On the lateral wall, I have got only one structure, that is humerus, right? But what are the muscles that are attached to humerus? Tell me. Yes, you are right that you have got humerus. Not only humerus, there are two more muscles that are attached to the humerus. So this is the lateral wall. So when this is the lateral wall, what is this muscle here? This is called as a biceps brachii muscle. Not only that, you also have 𝗠𝐞𝐝 here, right? So both biceps as well as 𝗠𝐞𝐝, but small change here is that there is short head of biceps as well as 𝗠𝐞𝐝. So these are the three important structures that are located on the lateral wall. When it comes to the medial wall, medially what do I have, guys? I have got ribs. Not only that, I have also got serratus anterior, only these two things, right? So let us write down there. So I have got ribs, that is the upper four ribs as well as serratus anterior. Okay, serratus anterior. Now, first important thing that was all the time asked in your exams is that what are the walls? So first question will be regarding the walls. Second question will be regarding the apex. Okay, the boundaries of the apex. Third important and the most important thing will be what are the contents? What are the contents of this axilla? What are the contents of axilla? So to remember the contents of the axilla, just remember it as LIAR, liar, right? Now what does L stand for? L stands for, as there is serratus anterior muscle which is supplied by a long thoracic nerve, so one of the content will be long thoracic nerve. Long thoracic nerve, or I can also call it as nerve of Bell. So after looking at these contents of axilla, I can frame one clinical task, guys, that if there is a blunt trauma injury to the axilla, then can I tell that this long thoracic nerve can be compressed leading to winging of scapula, right? I can relate in that way, isn't it? What does I stand for? I stands for intercosto-brachial nerve. Intercosto-brachial nerve. What does another I stands for? Another I stands for infraclavicular part of brachial plexus. I will tell you what is this, okay, when I will teach you brachial plexus. Okay, you know that brachial plexus is present in 3 locations, right? So some part of brachial plexus is present above the clavicle, right? That is called supraclavicular part. Next, next part of the brachial plexus is present behind the clavicle, that is called retroclavicular part. And third part of the brachial plexus is present below the clavicle, that is called infraclavicular part. Okay, so supraclavicular part has got roots as well as, so Li, and after I we have got A. What does A stand for, guys? A stands for axillary artery. A also stands for axillary vein. Next we have got axillary lymph nodes. Axillary lymph nodes. So these are the contents of the axilla which you definitely have to know. These are the contents of axilla which you definitely have to know. Okay, right. Next important question which was asked regarding this axilla is that, for example, if a patient is having any abscess in the axilla, any kind of abscess in the axilla, then how do you drain this abscess? If there is an abscess in the axilla, how do you drain it? How do you drain it is that, guys, see, simple way to remember. Let us say that this is the patient's shoulder. Okay, let us say that this is the patient's shoulder. And let us say this is the mammary gland. This is a female patient here. Okay, now here you have got 2 important things. Now let us say this is the clavicle, right? So there are 2 important things here. What are those 2 important things? What are those 2 important things are? Yeah. So this is the diaphragm. This is the hemidiaphragm here. Yeah, so this is how the picture goes. Okay, so here you have got 2 important things. What are the 2 important things, guys? So if you can concentrate here well, look here, this green color fold whatever I have drawn, this is called as anterior axillary fold. Anterior axillary fold. Okay, and this fold what I have got, this is called as posterior axillary fold. Posterior axillary fold. And if you see here between the anterior and posterior axillary fold, where is the this axilla? This is actually like this. This axilla is actually located like this, like a pyramid. Okay, so where do I puncture to drain the abscess? I puncture in between the axillary folds, in between the anterior and posterior axillary folds. I will puncture there. Okay, where will you puncture in between both of them? Will you puncture at the apex? Will you puncture at the walls? Or will you puncture at the base? I will puncture at the base region. I will puncture at the base. Okay, I hope you understood that the axillary abscess is done by making an incision at the floor or the base of the axilla, by the base of the axilla. This was a question that was asked previously. So mostly, guys, only few questions are asked from axilla, but all the things which are asked from axilla are really important. Okay, so this is all the discussion you need to know regarding the axilla.